Aubrey-Chimene. I am the owner and director of Grand Adventures Ranch, a holistic equine wellness education center in Sonoyta, Arizona. I specialize in teaching photopuncture, also known as acupuncture with light, to help equine lovers bring their horses to optimal health and performance. Each week we invite those who are interested in learning more about photopuncture, light therapy, and equine energy points to join us in discussing any aspect of these modalities. This call is not intended to diagnose, treat, or cure any person or animal. The opinions given are my own and are not intended to replace the advice of your veterinarian. I am not a veterinarian. I am a bionutritional consultant with over 20 years of experience in helping animals through nutrition, detoxification, and energetic balance. This week our topic is lighting up ulcers, or how to help horses with ulcers with light. So what are ulcers? Ulcers are truly a pain in the gut for both the horse and a caring owner, because a horse with ulcers can be hard to handle. Gastric ulcers are common in horses. About 50 to 90% of horses have been estimated to have ulcers, depending significantly on their type of food, housing, and athletic activity. Now, I think that number is very high. I think most of the people being asked and polled probably had performance horses, and they were talking to race horse owners and high performance animals, and yes, I would guess 50 to 90 is very reasonable. For horses that get to go out and be a horse and eat regular food, I think that's very high, but that's my personal opinion. I don't have I've had one horse with an ulcer in my life, and we brought him out of it, but none of the rest of the horses we've had in our care have ever shown an indication to ulcers. As you go, let me go back there. On that slide, you can see the difference of the stomach lining. On the healthy stomach, it should be smooth and pink and unlacerated. And stomach ulcers, you can see where the acid of the stomach has started eating through the digestive tract lining. Both in the stomach, it can also be down in the intestinal system. And in humans, it's more often caused by bacteria than it is in horses, from everything I've been able to tell. In horses, there's a number of different causes, and we're going to talk about that a little bit, and feel free to jump in with your knowledge and questions and so on. But in my opinion, the biggest leading cause of ulcers is stress. Now, what causes that stress varies greatly. The horse could be in pain. They're stressed from being isolated in their own little stall or separated from the herd and never having anybody. They are a herd animal. They are social creatures, so that stresses them. Acid-forming diets, lots of sugar, lots of starch in the diet, lots of high protein. The stomach has to produce more acid to break that down, and that acid eats through the stomach lining more often. Poor saddle fit can put stress on the energy flow to the stomach and digestive tract. That can be a big problem. Lots of things that cause stress. Anything where you have ongoing pain can cause ulcers. Okay, and of course, the first way to fix the problem is to get rid of the stress. If you have a horse that's only eating twice a day and stomach acid falls out and starts eating through the gut, feed them more often. If they're always in pain, let's get them out of pain. If they're isolated, get another horse, get them in with. We never leave horses alone. We try to always have horses have at least one buddy, if not a whole herd. If not a horse buddy, a goat, a chicken, some sort of buddy, so that they don't feel so isolated. Anybody else got additionals to that on what causes ulcers or what they've seen around horses with ulcers? You guys are going to sit back and be quiet. Okay, fine. So, what are the signs that a horse may have ulcers? Lots of times it's just they're off their food. They're not eating. They get irritable or snappy or nippy when they're eating. They pin the ears back at everybody, you or other horses. It may not be jealousy around food. It may literally hurt them to eat, especially hay. Because that hay is rough and it hits up against those nasty sores that you saw, and it's painful. What we think is colic may actually be ulcers. We're seeing colic, they're biting at their stomach, they're trying to get away from it. That may also, instead of colic, it may be ulcers, or ongoing or intermittent colic may be a sign of ulcers. Pinned ears, we talked about that, but pinned ears are biting when being cinched or groomed, especially around the belly and the flank. Horses that are ready to just take your head off when you're going to saddle them, check them for ulcers, okay? Ulcers that have been there a long time, especially hindgut ulcers, will go into body soreness over the lumbar and withers area. So horses, and it's kind of a, which came first, the ulcer or the pain? It may be a hunter jumper rider is landing on the loin and throwing the back into spasm, or it could be ulcers causing the back to spasm. So again, we need to fix both things, all right? And a big sign is just an unwillingness to move forward. That when you try to push the horse forward, add leg, get them moving, they start bucking and kicking. And a lot of that is because of where the muscles tie in along with the gut, okay? So all of those are signs. I'm going to give you a few points for checking horses energetically for ulcers, okay? I also highly recommend that you watch the video by Dr. DiPaolo. I posted it on the Equine Photopuncture page. He does a really good job of showing a horse. First, he shows you the points and where to check his way on a horse with no ulcers, and then a horse with mild ulcers, and then a horse with chronic. And you can see that chronic horse is ready to just explode. So it's a really good video. Now, you can check for ulcers anytime you're scanning and doing a photopuncture session and using the Inlight scanner. If the points that I'm about to show you come up on, more than one of them, do an assessment. Check for ulcers. Check a little bit further, okay? I like to use the scanner, or you can use just, if you have somebody who says, my horse has ulcers, or I think they might, you can use your thumb, you can use the end of a pen, you can use the end of a hypodermic needle cover, just a little soft plastic thing, and check the points and see if the horse flinches or reacts when you put pressure on each of the energy points. And I'll show you those points in a minute. We're going to talk about the dewlap, which I show in my class. This is, for me, the number one indication, is I go straight to that dewlap on the horse to see if a horse that's extremely reactive to that dewlap, I'm going to pretty much just assume they have ulcers. Be careful on checking these points, especially the dewlap, because it's a good way to get kicked, bitten, shoved into a wall. It is an incredibly sensitive area. Okay, so let me do my pen here. All right. Notice that the primary points that we check for ulcers come straight down in a line. Right down the front end of the horse, okay? We have bladder 13, so when we come straight off that shoulder, bladder 13 is right behind at the base of the shoulder blade. That's a really good indicative point. It's also the starting point for what we call the wither pocket. That kind of triangle that starts at the point of the withers goes back to where it ties into the spine here and goes forward just behind the shoulder. Bladder 13 may be reactive. On a horse that's been in pain a while, this whole area will be sore and reactive. So this is where saddle fit comes in. Saddles that are too tight over the withers can pinch this entire area, and a horse may be 10 times more reactive and start bucking because this hurts from the ulcers, and then you throw a tight saddle on it. We come down from there to pericardium 1. And when the horse is standing square, that's going to be directly behind the elbow in the rib cage. Okay, that's the top of that V where we check if ribs are in spasm. When horses have ulcers, ribs go into spasm a lot. And CV17 is directly below that. That is right over the sternum, okay? And so when you run your fingers down to the point of in between, right behind the elbow, okay, underneath, go straight down, drop straight down from the withers to the midline of the belly, and you'll find CV17. Any of the, and all of those will be very, very reactive to a horse with ulcers. Okay? And like I said, my favorite point for checking for ulcers here is the dewlap. You take this flap of skin that ties the back leg into the belly, and you very gently roll it between your fingers. If it is thickened, but the horse doesn't react, especially if it's thickened at this front end, the front end of that is right over a lymph node. And so if the horse has had previous ulcers or digestive problems or colic, that's often thickened and just stays that way long after they've come out of it. But if there's no reaction, they're not upset about it, it's old. But if you feel tight guitar strings in here, if you feel heat, if you have this horse pinning his ears and ready to kill you because you've been checking this, then I would have the horse scoped or just start treating for ulcers. It couldn't hurt, it could help. And when I say treating, I'm saying energetically. I do not just start willy-nilly giving things like Ulcer Guard. I think they actually do the wrong thing. But that's my particular opinion. Questions on that so far?
No question, but I agree with what Ulcer Guard for me.
Yeah, I'm not a big fan of Ulcer Guard. I think it's just a way to get you to spend money that doesn't really do anything. But these are go ahead, I'm sorry.
Oh no, just agreeing with you.
Oh, okay. All right. So anything that's not clear on finding these points? Okay, good. So this is how I would assess that I probably need to treat for an ulcer, okay? And I can show it to the client. I can show them how to do a quick assessment, especially, just straight down. I don't have to know what the points are. I just tell them to check that line down from the withers or have them watch Dr. DePaulo's video. But how can we help? How can the lights help? Well, first and foremost, let's get the horse out of pain. So where I start is, if all you have is a light pad, awesome. Start with the light pad. Use it over the withers. Use it here over the loin. And flip it out. Be careful. Notice I have a polo wrap on this horse, and it's going right over that dewlap. I do the loin last. And usually by the time we've treated over the withers and then treated down here underneath between the front legs, we're okay back here to treat. And most horses are okay about something as soft as a polo wrap. It's really only there to help free your hands up. But if you have to stand there for 10 or 15 minutes with your hands holding that light over the loin, then do it. Okay? If that horse is super painful in the dewlap, don't try to put a polo wrap around it. It's a good way to get yourself hurt. But that's going to cycle through 3-5, it's going to help bring in circulation. It's going to help lower pain. It's going to help relax those muscles that have been so tight. I don't know if you've ever had an ulcer, but it feels a lot like having the worst pain of food poisoning. So everything tightens and goes into spasm. So start with the pads, just over the withers, between the front legs, and up here over the loin. Okay. And if you have a client who has a horse with ulcers, sell them a pad. In this particular instance, we're using a pole cap. It works great, but any of them, the ankle saver works phenomenal over the withers and over the loin. It's great. Okay, so any of them will work. Maybe not the hawk, but it would work. It just wouldn't be as convenient. So then I use photopuncture and go to specific energy points to help balance the whole body and help the body heal from not only lower pain levels, but heal from the ulcer itself. Okay? On the front legs, we're going to use large intestine 11. And this picture is actually off a little bit. when you lift the knee, it's going to be right in here in the joint. It's just on this old picture, the joint is a little low. Okay, I showed it in the joint instead of up here. But it's where your finger would sit if you picked up that knee and bent the leg toward the chest. Okay? That is a master point for digestive disorders. It helps a lot. Okay? Excuse me, this is the sorry, I'm confusing myself today. I don't know why I put them on the wrong order in here. Large intestine 4 is the master point for digestive orders. That's right below the bone of the knee. Okay? Large intestine 11 up here is the earth tonification point. So that point helps to support the earth sisters, stomach and spleen. And then pericardium 9, right between the heel bulbs. That's going to help support liver and gallbladder. And a lot of times, the organs of elimination have been just overwhelmed. Ulcers are often a toxicity issue. And of course, if we have tissue being eaten by the extra excess acid in the stomach, all of that gets processed out by the liver and kidneys and so on, and we want to help support them. So pericardium 9 just is going to help with balancing wood at the same time as we're balancing earth. Okay? So that's the front legs. On the back, and everything we're going to do here is on the legs. I always start with the front. Hopefully we've started getting enough response that the horses calm down that I can come work on these back legs without any danger. But you want to be very, very, very careful. Do not get your head in front of one of these horses' feet when you're treating a horse with ulcers. They might be the sweetest thing in the world, but if they're in pain and you accidentally put your head in the wrong place and stick a light on something that shifts stuff, they could kick you so easily. So be very careful. Stand very close to the horse. Be right up with them. And just be smart about how you're putting the lights on the body. And I do say treat both sides whenever possible. Okay? So we're going to come in and do gallbladder 34. I usually do it at the same time as stomach 36 because we're just right here on both sides of the head of the femur. All right? Gallbladder 34 is again an earth tonification point, so we're supporting stomach spleen. Stomach 36, those of you who've been in my class know that is my absolute all-time favorite energy point. It's the probiotic point. And so it's going to help with overall digestion, with helping to lower pain levels, but is a master point for the GI tract overall. Bear in mind, it is a down and out point. If you have a pregnant mare and you treat this point, it's not guaranteed that it will, but there is that potentiality for it to create a spontaneous miscarriage. Okay, so if it's your horse and your horse is in massive amounts of pain and you want to treat it anyway, go for it. If it's somebody else's horse, don't take the liability unless you really know them well. Spleen 6, this is a balancing point for all lower abdomen issues, whether they be reproductive or digestive, etc. We have so much pain going on here in the lower abdomen. Spleen 6 is just a really good place to start to help balance that. Anytime you have anything in the lower abdomen, whether it's a bladder infection or kidney or reproductive, just put some lights on spleen 6. It couldn't hurt, and it might just do it a massive amount. This is that point that always, 9 times out of 10, if you have a point that scans halfway up the back leg on the inside, it's spleen 6. Okay. Spleen 4, which is right below the head of the cannon bone. This is a connecting point that balances the energy between stomach and spleen. We have liver 2. This liver 2 and stomach 45 are both sedation points. You can treat them both at the same time while you're down at the ting points. They help to sedate the hindquarters, the lower body, lower pain levels, etc. Now, I did not put the stomach spleen association points here, which are bladder 20 and 21, just in front of and behind the last rib. No reason you couldn't do it. I usually don't treat more than about 10 points, and I didn't want to throw a ton in here. But there's nothing wrong, especially if you've got a horse that's in a whole lot of discomfort. There is nothing wrong with starting up on the spine and staying away from the legs while you get things moving. Okay? So here's the overall on that chart. Any questions so far? I would normally start with levels 2 and 5, or excuse me, 7, then 2, then 5. But muscle test for it. There's nothing to say that gently, if you've got a horse that's just so reactive, maybe we go really low. We start at 3 or 4, and we end on 6. So we sedate it just a little bit and leave it a little sedated. Okay? And a few other things for adjunct support that you can do with ulcers. These are really good things to be talking to your client about, or to know if it's your horse that has ulcers. Alkaline diets, again, let's stop having the body having to produce so much acid. When there's more protein, when there's more starch, more sugar, the body produces more acid to break it down. So alkaline diets are greens, so your grass hay, not your alfalfa, your grass hay. Copra, the shredded coconut is awesome. Coconut in general, coconut oil, lots of studies now have been showing that it reduces the pain from ulcers and helps to heal ulcers very quickly. I personally, my favorite is Sangre de Drago. It's one of my favorite herbs on the face of the earth. You can get it from Herb Farm and a few other places now. Just Google Sangre de Drago. It is a sap from a tree. It instantly stops the pain of the ulcerations. It's so amazing. They've been using it in humans now for 400 years. And just in the last 60, there have been, I don't know how many hundreds of studies done, National Institutes in Health and on down, okay, and there's even a patented Sangre de Drago drug now for human ulcers. But there's no reason to go to that expense. Just get Sangre de Drago, and you can give anywhere from 1 to 3 ounces by mouth directly into the horse. Most horses will lick it out of the bucket, and it is amazing stuff, okay? And the number one, have food in front of that horse 24/7. Don't let him stop eating, because it's when they stop that ulcer pulls up, the acid pools and starts eating away the stomach lining. Okay. Any feedback, questions? That give you what you need, Aaron?
Yeah, that was fantastic. Thank you. I actually haven't heard of that herb, the Sangre de Drago. Never heard of that one before.
That is the sap from a tree from South America. It is one of those ginormous trees that you see going way up into the canopy, like 300, 400, 500 feet tall. Okay. And if you were hacking your way through the rainforest with a big machete and you accidentally cut yourself, you would cut this tree and it bleeds this bright red sap. And the sap is actually over 90% proanthocyanidins or bioflavonoids. If you put it on a clean wound, it will stop the bleeding, lower the pain almost instantly, and seal it up like a Band-Aid. If you put it on an infected wound, it won't do that. It'll make it drain. And my veterinarian, Randy McMillan, a few years ago, this must have been almost 10 years ago now, he managed to chigger his leg with a running chainsaw right across his thigh. About 4 inches across and a good ½ inch deep before he caught himself. He went over, he flushed it out, he took the bottle of Sangre and he just poured it on, probably 3 or 4 ounces. He said within 5 minutes, the bleeding had stopped. Within an hour, all the pain was gone. He never bandaged it. He never covered it to shower. A month later, the scab fell off. He didn't even have a scar. He uses it on all of his surgeries in his veterinary practice. Like I said, I love Sangre. I can talk for hours on Sangre de Drago. We've used it for everything. And I had a client call a few years ago that had a oh, I should have put pictures of that horse in here. She had a Morgan stallion, multiple winning champion stallion on the East Coast. His sire had been one of the best horses she'd ever had, also multiple winning champion, and the sire had died when he was like 12 years old of ulcers. This is her new stallion. He's just coming up 11, 12 years old. She's sure he has ulcers. The vets are saying, no, 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 he doesn't. She took him and she drove him 6 hours to where she could get a long enough scope. And they went in and they scoped him, and as they were pulling back out, he didn't have gastric ulcers. He had ulcerating tumors around the esophagus. And they sent him home to die. They said, oh, no, we can't treat it. Sorry, it's too deep for whatever, She called me. We put him on, he was doing, I think the first week he did 4 to 6 ounces of Sangre de Drago a day, like 2 ounces at a time. It only took 2 days before he was eating. It only took him 2 weeks before he started really putting weight back on. And at 45 days, he was back in competition, full out boogie. They rescoped him like 7 months later, and he was fine. Now, we also did some other stuff for the cancer, but the ulcer problem was the ulcerating tumors stopped bleeding almost immediately by indication of the horse. So anyway, any other feedback? Okay, the floor is open. Questions on anything else? Darn, we're actually going to be done on time? Okay, guys. Well, enjoy. And somebody asked me for something next week. I can't remember what it was, but I have it written somewhere, and we'll do that. Talk to you later, guys. Bye-bye.